Hi, my name is Georgia Teague, and I will be talking about my evaluation of the health intervention, the Georgia Stroke and Heart Attack Prevention Program. A description of the Georgia Stroke and Heart Attack Prevention Program. This initiative was created to help serve low-income communities and populations to assist them in receiving treatment for conditions like hypertension and reducing the risk of chronic problems like cardiovascular disease. This program is funded by the Centers for Disease Control and Prevention, also known as the CDC. They use the chronic care model to help in the approach of offering low-cost medicine, lifestyle counseling, and continuous monitoring of conditions. In addition to these resources, they also offer an encouragement to good practices like medication adherence and treatment adherence, while also encouraging regular visits in addition to the resources they provide. When looking into the theory of disease causation used throughout the program, it is a complex array of different factors, meaning that there is a most likely chance of a multifactorial approach being the best fit. Chronic disease on its own has a multitude of places that can affect it, being biological, behavioral, social, and environmental factors. This pairs well with the program as it addresses systemic, behavioral, and clinical factors that can affect the disease. While on the other hand, the program emphasis. It is clear that there are many different pinpointed ideas throughout the program that you can trace back to the three various elements being host, agent, or environment. Certain environmental factors that can be accessed are medical locations. While focusing on agent, you can look at the treatment options, but there is definitely a strong emphasis and focus on the host, also known as the patient or participants of this program. Establishing a need for cultural and ethical concerns. There are many considerations that need to be had on a cultural standpoint, as there are many different options for treatment in this program. Something to consider could be dietary needs or restrictions depending on culture, and the large mistrust in the medical system that has been established in many cultural boundaries. There's also the strong potential of language barriers or health literacy understanding. On the ethical side, it is very important to always remember informed consent, which ties back to the health literacy, where there is a level of understanding that must be had. There is also an ensuring of non-coercion for medication and treatment that is offered to those enrolled into the program. When looking at the effectiveness of this program, they have a great baseline for evidence in both quantitative and qualitative aspects. On the quantitative side, they have evidence of the lowering of both systolic and diastolic blood pressures over time with adherence to the program and the medications provided. While on the qualitative side, they have asked how receptive their participants and patients are to the lifestyle modifications recommended to them throughout the program. These are evidenced by the significant lowering of blood pressure and cardiac events comparative to the control group. When considering a program redesign, there are a few small modifications that could assist the program with realistic and inexpensive options that could help cost effectiveness, patient access, and overall sustainability. The first of these options could be helping to train community health workers instead of relying on nurses, which is both cost-effective and efficient staffing for most areas. And an area that is already focused on in the program is dietary recommendations. In addition to this, a small step could be helping with meal prep and meal planning for individual patients to help create realistic options. In addition to this healthy eating, grocery vouchers could help patients afford healthier food options to promote actual adherence to the program. And finally, A digital adherence tracking program could be a realistic option for patients to access on their phones to help with medication and appointment reminders. Thank you so much for listening. Have a wonderful day.